The return to school coincides this week with the release of the 33rd annual Kids Count report released by the Annie E. Casey Foundation. This year, Oklahoma's ranking actually improving a bit. We've moved up from 42nd in the nation to 40th. So as Jason Joyle reports, there is still plenty of room for improvement.
Quite a few children in Oklahoma are facing tough times. This year's Kids Count report examines 4 areas ranking a child's well-being for all 50 states.
It ranks child well-being in 4 domains of economic well-being, family and community, education, and health.
Overall, Oklahoma's ranking has improved slightly, but there is a need to continue to address the issues kids are facing.
I would like to note that of those 4 domains, the only one we actually improved in was economic well-being. We moved from 33rd last year to 32nd this year, and that follows largely a national trend of federal investment into public programs and direct support to families.
Breaking down the 4 areas in this year's report, Oklahoma ranked 41st in family and community context, 45th in education, and 42nd in health. Slightly more than 1 in 5 children in Oklahoma live in poverty, and that leads to less access to healthy foods and other services. The free and reduced lunch program in schools can help lighten the burden for some parents.
A lot of people will turn their nose up at free and reduced lunch programs, but not only does that help the child and help the family with the costs that we're seeing with inflation, but it also helps the school district because so many programs federally are based on the free and reduced number population.
Joe Dorman is the CEO of the Oklahoma Institute for Child Advocacy.
And so if you qualify, I would encourage people to sign up, even if you don't take advantage of the free and reduced lunch program, because it will help bring more money into your school district and help the kids overall.
One of those groups who benefit from such programs are grandparents raising their grandchildren at a time when they don't have much flexibility in their budget.
So a lot of grandparents are in poverty. They need some financial assistance. They need help being connected to resources. They just need everyday help with getting schools or getting children enrolled.
In Oklahoma, more than 43,000 grandparents are raising their grandchildren.
Actually, for every 1 child in the foster care system, there are approximately 8 grandkids being raised by their grandchildren in the state of Oklahoma.
The Kids Count report shows our kids are dealing with stress and anxiety.
One of the most challenging things we saw was the increase in need for mental health assistance. As a result of the pandemic, we saw that it was about a 15% increase on children that are school-age children in need of mental health assistance because they were experiencing anxiety or some type of trauma.
We've seen an uptick of signs of depression, anxiety, not just through the pandemic, but it was on the rise even before that. But with all of the extra stressors that both our children and our families have been under, there's definitely been a rise.
Cynthia Mooney with Mental Health Association Oklahoma feels for parents who are trying to figure out if their teenager is being moody or might need some mental health help.
That's a tricky one as a parent because the last thing we want to do is miss a sign. But you're right, a lot of parents don't even know what that might look like. What does a typical 12-year-old act like? Well, there's no real answer for that because every child's so unique. But parents notice, they can feel it in their gut when there's a change.
For grandparents raising their grandkids, mental health help is almost a necessity that's hard to access.
The grandkids in those situations have a higher number of mental health issues and just behavior issues, and the grandparents really don't know how to adjust and to take care of those because usually they're the grandparent, they're the fun loving, they get to do the things on the weekends and not the parent role. So it's a huge switch.
Using the elementary and secondary school emergency relief or ESSER funds provided by Congress through COVID pandemic relief to schools is one of the ways school administrators say they're addressing student mental health needs.
We have added 22 counselors, new counseling positions since 2019. We are also working with NorthCare to have case managers in our district. And this is something that's new to Edmond. I know other districts have had that before, but it is something that we have done in response to COVID as we have seen those mental health needs increase in our students.
During this week's State of the Schools Forum held by the Greater Oklahoma City Chamber of Commerce, those school leaders noted that to continue helping students, state lawmakers and school districts will need to find a way to replace those temporary federal funds.
We're going to be facing a funding cliff as these ESSER dollars run out, and so that's something to be really focused on. I can't do away with my mental health providers, and I can't do away with my intervention specialist when those ESSER dollars run out.
Advocates say state policymakers should begin working on a solution now because the state's children are already behind the curve. Jason Doyle, the Oklahoma News Report.